Hi, everyone. Good morning. Welcome. My name is Kirti Kanchinadam. I'm a Policy and Outreach Manager at the California Pan-Ethnic Health Network. I'm based up in the Oakland office, and I'm going to be your facilitator for today. Next slide. We're really excited to have you here today. It is our second webinar in the Mobilizing for Health Equity training series. This series is open to all, but really designed to support the work of the Having Our Say Coalition, which is a statewide coalition comprised of over 30 organizations that work together to ensure that voices of communities of color have a voice in part of the healthcare policy discussions happening at the state level. So this training series was designed with Having Our Say's input, but we hope that together that these trainings and series will help provide foundational knowledge and tools around health equity advocacy and policy work. So we invite all community-based organizations who are interested in learning more about advocacy, whether strategies around legislative work or budget work, which we'll be discussing today, or around administrative or community organizing and direct action strategies, which we'll be discussing more in future webinars. So today's webinar is our Budget and Legislative Advocacy webinar, part 1. So we're going to really focus on the basics of the legislative and budget cycle, sort of an overview of the key players involved, and really look at how us as advocates can leverage the timeline and cycle to advance policy. So this webinar will be a higher level, looking at the importance of timing throughout the legislative and budget cycle, and will be a primer for future webinars. And in particular, the next webinar on our list is a part 2. So we really hope to build on what we're learning here today together to go more in depth on certain aspects of legislative and budget advocacy in part 2. So throughout today's webinar, we will encourage you to ask questions through the chat box. And in particular, the more questions we get, the better sense we can get to tailor part 2 to address your needs. So keep in mind that some of the more in the weeds questions we might address in part 2. Next slide. So on that note, we can go through some quick housekeeping. We really do want to encourage this to be a learning environment as much as possible. So please use the chat box, the question and answer box on your screen to ask us a question for the speaker at any point. You can just type it in there and we will collect them and pose it to our speakers towards the end of the webinar. And today's webinar will be recorded. So we will share a link with you after the event is complete in about a week, and we welcome you to revisit the content yourself and share it with your colleagues. And finally, we really hope that you will take a moment at the end of the webinar to complete a quick evaluation survey. We really value your feedback, and it helps us measure our work and adapt the rest of the series to your needs. So I want to give a quick thank you to our team here at CPEN that's been involved in putting this together. And you can find all of our email addresses on the website, and we encourage you to reach out with any further questions. And with that, I want to introduce our speaker for today, who is Linda Tenerowitz, is a policy advocate at the California Pan-Ethnic Health Network. She's based in our Sacramento office, before joining CPEN, Linda worked as a legislative aide to the State Assembly member, Freddie Rodriguez, advising him on health policy, public safety, and the state budget. She's been a great advocate, really working for health and health equity and culturally competent care. So we're really excited to have her here at CPEN and happy that she'll be kind of sharing her knowledge with all of us here today on the webinar. So I think with that, I'm going to turn it over to Linda and let her kind of take over.
Great. Thank you so much for that introduction, Kirti. As Kirti mentioned, my name is Linda, policy advocate at CPEN. So just to preface this presentation, want to let people know that this is very high level, so please don't hesitate to reach out to me. My contact information will be listed at the end of the presentation, so if you want to send me a quick note to answer any burning questions, please don't hesitate to do so. Next slide, please. So a little bit about CPEN. So we are a collaboration of a variety of different health organizations that was founded in 1992, and we really value the power of collaboration. And we feel that collaboration really builds strength, especially when we're advocating for issues that are so shared between different communities. So as you can see, some of our community partners are listed here. These are our founding members. We have the Asian Pacific Islander American Health Forum, the California Black Health Network, Latino Coalition for Healthy California, and the California Rural Indian Health Board. Next slide. So this is a little overview of the kind of work that CPEN does. A lot of what I like to refer to CPEN as is kind of like a mini think tank. A lot of the work we do revolves around conducting research, identifying where disparities exist, and really providing recommendations to the legislature to create policy changes that would influence equitable conditions in our society. And we do that through empowering our community partners. A lot of the best bill ideas, in my view, come from the grassroots, because the folks doing the work on the ground, working with communities, are the ones who are going to understand the issues and how to best resolve them. So elevating voices of folks who are doing the hard work on the ground helps us, do our jobs in Sacramento, to advocate for the policy changes that we need to see in the law. Next slide. So we'll jump right into the budget and legislative advocacy overview. Next slide, please. So I wanted to start with a quick lay of the land. I know some folks might not be too familiar with how the legislature is framed and kind of what the bodies look like. So just to give a quick overview, we have a bicameral legislature. And so what that means is that we have two houses of government. We have the Senate, which has 40 members, and they represent larger districts. So a little more than 900,000 people are in each Senate district. And then we have the second house, which is the Assembly. And the Assembly is made up of 80 elected members who represent smaller districts. So these are about a little bit over 460,000 people. So given that we have two houses, these districts overlap each other, and a lot of the reason why we have two houses is because the Senate, being the larger district and entity, can be described as being further away from the people because it is such a large district, and then the Assembly is referred to as kind of like the smaller of districts. So they're closer to the people. The members have a smaller population to represent. So in a lot of ways, that representation is a lot more specific. So a lot of the purpose of these two houses is they provide a check and balance to each other. And then a quick word on term limits. So as of 2012, there was a term limit change to make term limits a total of 12 years. And so the purpose for that was to ensure that we did retain institutional knowledge. So if we had members kind of churning in and out of the legislature, you lose a lot of the history and a lot of the expertise really that existed in that member's repertoire and their history in the legislature. And then the two houses also have different term limits. So in the Senate, you have 4-year limits, or 4-year terms rather, and then in the Assembly there are 2-year terms. So senators run for re-election every 4 years, Assembly members run every 2 years. And so within the 12-year total, that can be a mix, you can mix and match, how many years an Assembly member or senator wants to commit to. So for example, a member could run in the Senate and do 2 terms in the Senate, so that's 8 years, and then do an additional 4 years in the Assembly, and they can take breaks in between that, but the only limit is that it is 12 years total in either house. And then lastly, the whole reason, members come into the legislature is to enact change to our laws and vote on bills. So bills must be passed in each house and in the same form. And so what I mean by that is that when bills are introduced in both the Assembly and the Senate, each bill is going to have to transfer to each other's house so that they can each take a crack at it and vet the bill as well. And so you're never going to have one bill that's only going to be analyzed by one side of the legislature. It's going to go to both. Next slide. So as you may recall, in November of 2018, we had the general election. And so this was a very big election for California in that it was very, the tides have changed a lot for the Democratic Party. So this year we're experiencing a supermajority of Democrats in both the Senate and the Assembly. And so just to give a little breakdown, we have 29 Democrats in the Senate, 11 Republicans, 3 of the seats split from Republican to Democrat. We have 3 newly elected women in the Democratic Party. And we will be seeing a special election coming up in March to fill Senator Lara's seat. And so Senator Lara is a Democrat from the Los Angeles, Southern California area. And so he has been elected to be the insurance commissioner. And so that seat right now is vacant. So we'll keep a close eye on who takes that seat over. In the Assembly, we have 61 Democrats and 19 Republicans. This actually recently changed. We used to have 60 Democrats and 20 Republicans. Fun fact, so Assemblymember Mainshine, who represents San Diego, he won as a Republican, and he recently just changed his party affiliation to be Democrat. So now we have 61 total Democrats and 19 Republicans. In the election, we saw 5 seats flip from Republican to Democrat, and we have 5 newly elected Democratic women. So as we can see, California is really moving in a progressive direction, and that's really going to inform a lot of the different policies that we see in this coming session. Next slide. So this is just a graphic to give you a bird's eye view of the lawmaking process. So as you can see at the top, we have the Assembly and Senate. And so both of the trajectories of how bills are introduced are moving at the same time. So of course, a bill idea comes to fruition. Both bills are going to be bills on each side are going to be introduced and then going to be heard in committees. And we'll talk more about that in a little bit. And the committees are basically going to vet the bills, vote them out or defeat them, and then they'll continue on through the process and then switch to the other house so that that group of members can evaluate the legislation as well. And so once both sides have completed their cycles, the bills that have been successful through the process will then go to the governor. And so the governor has the ability to approve and sign the bills into law or veto the bill, basically defeating it entirely. So the governor has 12 days to sign the bill once it reaches his desk. And so given that 12 days, he can approve or veto the bill. If the governor takes no action and just doesn't sign or veto the bill, it automatically will become law by default. And that's the process of how the governor will approve and veto bills. Next slide. So just to zoom in a little bit closer on the legislative cycle, this just kind of gives you a good idea of kind of the time frames that we're looking at. So the first house, so if you're starting in the Assembly, if you're starting in the Senate, that'd be the Senate. Between January and February, bills are going to be introduced. So legislators are collecting ideas, listening to stakeholders, getting a sense of what their priorities are, and introducing bills based off of those concepts. And at that time, the bills will be given a bill number, which allows the public and everyone to track that legislation. And so that process happens between January and February. So we're just wrapping that phase up. Moving into March through May, so this is when policy committee hearings will start. And so policy committee hearings are the opportunity for smaller subgroups of the legislature to really hone in on the specific issues that the bill is going to be addressing. So the policy committees have a lot of leverage and a lot of power to determine what bills are going to advance and which ones are not. So that's the policy committee process, March through May. We take a spring recess to give the legislature a break, and then we resume back in May. And so May is really interesting because that's when we have fiscal committee hearings. And so for fiscal committee hearings, this is an opportunity for all the bills that we heard in the policy committees to understand how much the bill would cost to implement. And so in these types of hearings, we're strictly looking at what the cost is. Does the state have the ability to afford it? And this is a great opportunity to kind of dig into the numbers of what a bill would need to be implemented. And this is also an opportunity for advocates and stakeholders to, pare down costs if they want the bill to be successful through that committee. So this is a lot of number crunching. And so moving on to the second house, if the bill is successful through the fiscal committee, it'll transfer over to do the exact same process on the other side. So June through July, policy committee hearings will start again. Again, looking at whether or not the bill is a good idea, just strictly looking at the policy. We break for summer recess, come back again in August, and we have fiscal committee hearings again in that second house. And then we're moving to floor session. And so floor session is the opportunity for the entire body, the Senate and the Assembly, to vote on whether or not the bill should advance. So this is when all the members of each house have the opportunity to vote the bill forward or not. And then lastly, September through October, the governor has the opportunity to sign or veto the bills that have gone through the process. Next slide. So to dive into a little bit about the policy committees, each house, as I mentioned, has a congruent policy committee. So for example, for our purposes in health policy, we pay a lot of attention to what's going on in the health committees in each house. And so they're the same apply for education committees, transportation. They all work kind of parallel to each other. And so the legislators elected to both houses, they are selected to serve on those policy committees. And a lot of times the legislators are chosen for those committees because of their personal expertise. They might have history working on a certain issue. So those members are likely to serve on those pertinent committees. And lastly, the legislators who serve on the committees really have a lot of power in shaping what the priorities are for that committee and what is going to get through and what's not. And so each committee is going to vote on those bills through a majority vote. Next slide. And so as you can imagine, the members who sit on policy committees are very powerful. And the people who are designated to serve on those committees are appointed by Assembly Speaker Anthony Rendon or the Senate Pro Tempore Tony Atkins. And so both of these individuals were elected by their peers to identify who's going to serve on each committee, and they're also responsible for leading the party, the majority party in both houses. So as you can see, making sure that members have good relationships with these two figures is going to be very beneficial for the committee assignments that they want, and also the committee chairmanships that they're seeking as well. And so as you can imagine, because both Speaker Rendon and Senate Pro Tem Atkins were elected by their peers, there are some people in the legislature who did not support them. And so as you can imagine, consequently, those members did not receive committee chairmanships or memberships on committees that they wanted. So that's just a little bit of the political piece here. But again, just underscoring the influence that these two members have in shaping who sits on committees and who has that decision-making ability is very key. Next slide. So we spoke briefly about fiscal committees. And so the fiscal committees, like I mentioned, were all about identifying the costs the cost of bills and how they would be implemented and how much money the state has to invest in them. So one thing about the appropriations committees is that it's really important to lobby the appropriations chairwoman or chairman. So the appropriations committee chairs have a lot of say in what the priorities are. Again, they were appointed by the speaker as well as the pro tem, and so they really have a lot of influence over which bills they want to advance and which ones will not. Next slide. And so where do we plug in as advocates? So there are a variety of opportunities to leverage change. So in the first house, as we described, is January through May. We can do things inside and outside the Capitol, and both of these issues can happen concurrently and at the same time. So for one, outside the Capitol, building a campaign. I think a lot of what we do is to gather the forces of all of our community members and figure out how we can message, how we can provide social media and really get the word out about different priorities and bills that we want to see go forward. So building a campaign is a great way to kind of bolster support for legislation and also get the community involved. Forming coalitions. I think, as we mentioned earlier, forming a base of people who have greater bandwidth is always going to elevate the issue to the legislature. It's important not to work in silos, especially if you're making a big ask. So forming a coalition in a larger group is always helpful. Submitting letters. You don't have to be in Sacramento to submit a letter of support on a specific piece of legislation. You can submit letters online. You can submit your letter through a policy advocate. So making sure that your voice is heard, and that's putting pen to paper and making sure that as things are moving through the legislature, that your group's position is reflected. That's incredibly important and very helpful to all the members who are advancing legislation. Again, engaging with social media, that includes the press as well. So if there are folks who are experiencing issues on the ground about a certain issue and they want to explain why a bill is going to help that community or that specific problem, reaching out to local media sources is always a great way to elevate the issue as well. And then in terms of inside the Capitol, meeting with legislators and their staff is a great way to really get face time with those members and make sure that they're being held accountable to the people that they serve. So advocating for why a bill is going to affect the community, why a bill shouldn't advance if it's going to harm the community. Those are all things that legislators want to hear from the folks that they represent so that they can make a more informed decision. And then lastly, inside the Capitol, providing public comment and testimony in a policy committee hearing is always very powerful. So if you've been directly affected by an issue, a legislator may ask that person to come testify to that committee to describe why the bill is needed. And that's always a really great way to advocate as well. Next slide. So some advocacy tips. It's helpful to research the member you're going to be meeting with and speaking with. And this is not to say that you have to go in deep research mode or anything, but just knowing a little bit about the person you're speaking to is really going to help inform the way you frame your arguments. So, for example, if you know that Assemblymember Arambula is a physician, you might want to talk a little bit about the work that he's doing with ACEs or with children and kind of make the nexus between kind of the medical side of his work and how that would inform his policy-making abilities. So just providing those connections and making it relevant to what that member's expertise is really going to help kind of bridge those gaps. And definitely members, they take notice when the advocates they're meeting with have done their homework and can cite kind of their history and what they've done in the past. That's always really helpful. Being mindful of time. one, being mindful of how much time you have with that member and making sure you can get through your policy agenda, and making sure that you're not spending too much time on one bill, that you don't include the other issues on your priorities list. So just being mindful of the time that you have, being concise, but also, accurate is also really key. Also, too, advocacy days are very busy in the Capitol, so giving yourself enough lead time to travel from one office to the next. It can get very busy. There's also a lot of hustle and bustle with different advocacy days happening side by side. So just being very mindful of the time is key. Again, answering why bills matter to the community, and then leaving with a direct ask. So you never want to leave a meeting without making a very clear request of the member. So it could be, I'm requesting support on AB1, or I'm requesting, you, assembly member, to talk to leadership to elevate the Health for All issue. So leaving with a direct ask is really important. And then also providing resources. So making sure that staff, that the member, that they have all the information that they need, talking points to conduct your ask if it's helpful. And then lastly, offering to follow up with the staff. So every time you leave a meeting, making sure that you're providing your contact information, letting staffers know that you will be available to follow up, answer any technical questions. That's always something you want to leave behind. Next slide. So moving on to the budget process. So this is another aspect of the legislature that specifically deals with funding. And so we talked a little bit about, how the bill process works. So now we're shifting gears into budget. Next slide. So the budget process. So to give you an idea of the time frame, so between January 10th and May 14th, a number of things occur. So earlier this year, Governor Newsom released his proposed budget, and that was done on the 10th of January. And so this really lays out what the governor's vision is for how the state should spend its dollars. And really, when we talk about the budget really is an expression of the state's values. And really what the governor has expressed is that he really wants to work on healthcare. And that's really exciting because in the past we haven't seen that from previous administrations. So really this has really set the tone for what the governor is expecting to see in this year's budget. So once the budget proposal is released by the governor, budget subcommittees start to meet to really pick apart every aspect of the governor's proposed budget. So budget subcommittees are responsible for holding hearings and reviewing line by line all of the issues that the governor has put forward. And we'll talk more about budget subcommittees in a bit. And then lastly, we have our advocates. So advocates are also combing through the budget, looking at, the things that we want to support, the things that we maybe don't support, and then also providing recommendations for things we'd like to see added to the budget. So at this point in time, just making sure we're meeting with budget staff, budget leaders, and making sure that our issues are heard and we're making that known. And then moving to May 14th through June 15th. So by May, we will get what's called the May revise. And so by that point, the state will have a better understanding of how much money we have to work with. So we'll be getting updated numbers on tax revenues. And so that'll really change what we see as the forecast for the budget going forward. So by mid-May, the governor will release his revised budget with those updated numbers, and then the budget subcommittees hold hearings again on those revised proposals. And then lastly, the budget conference committees will meet to finalize any differences. So budget subcommittees exist in both the Senate and the Assembly, and so both houses are generating their own versions of the budget. And so because we have different versions, the two will come together in conference committee to iron out any of the differences and then consolidate into one single state budget. And again, advocates are continuing to make asks, testify in hearings, submit letters of support for things that we want to see continue, and again, making asks for things we want to see added. Next slide. So the total budget in this administration's proposed budget is a $209 billion budget with general fund spending of $144 billion. And so the general fund, these are really, it is what exactly as it sounds. The general fund are funds that are not siloed into any particular area. And so these can be used for a variety of different sources, different things that advocates are looking for. They're unrestricted in their usage. And so we have, specifically for Health and Human Services, $158.6 billion in spending for health, and then for our rainy day fund to help pay off debt and further pay off our debts, and also in times of economic crisis, making sure we have a cushion. $4.8 billion was invested in this year's budget. Next slide. So as we can see, Governor Gavin Newsom has put a lot of money towards health. So as we can see, our first bullet, health for all, it's not quite health for all, so it's health for age up to 25. So this is coverage for undocumented young adults. On the advocate side, we're continuing to push back and hope that we can actually achieve health for the entire adult undocumented population. But so far in this iteration of the budget, there's $260 million allocated for undocumented young adults. We also see an investment for Medi-Cal quality, trauma-informed care. This is also really groundbreaking for the legislature in that we're really taking a closer look at adverse childhood experiences and really looking at health in a preventive way and kind of nipping things in the bud where they start. So a $52.5 million investment has been proposed for trauma-informed care. We also see the Black Infant Health Program, $7.5 million invested to increase case management and maternal care visits. So this is also an issue that we've had tremendous research on, and to see that there's such a line item in the budget to address this issue is incredible. So great to see that in there. Home visits, CalWORK's pregnant women are in need of assistance and home visits to assist with the issues that they have going on. So $23 million has been proposed to go towards that project. And next slide. Other key investments, we see census. We know the census is incredibly important for identifying, who is in the state and how we can allocate dollars, accordingly. We also have funding for immigration to help community-based orgs, respond to the needs of the plight of navigating immigration services. There's money for the Earned Income Tax Credit, CalWORKs grants, affordable housing and homelessness, and safe drinking water. So as you can see, the governor's proposed budget is incredibly progressive, and there's a lot of information and a lot of programs in here that certainly we'd like to support. Next slide. So to pivot back to the budget subcommittees, so these are the committees, like I said, that are responsible for evaluating all of these great proposals that the governor has put forward and further tweaking them or enhancing them. And so budget subcommittees, much like policy committees, they each have a different focus. So, for example, the two health budget subcommittee chairs are Dr. Joaquina Rambula in the Assembly and Dr. Richard Pan in the Senate. And so these two chairs are going to be evaluating all of these different proposals as we move throughout the year. And another opportunity for advocates to get involved is to testify in subcommittee hearings, as well as submit letters of support for any of those programs that have been proposed by the governor. And so that's a perfect opportunity to get plugged in there. Again, these are the two members that we really need to advocate to make sure that those priorities, continue in the budget and are reflected, throughout the process. Also, these two committee chairs, as well as all the subcommittee chairs, will be responsible for reporting out their recommendations to the full budget committee. So you can think of the full budget committee as like the larger committee with all these different arms to it dealing with health policy, education, transportation, etc. And so those smaller committees are going to be reporting to the larger budget committee. Next slide. So the full budget committee chairs are Assemblymember Phil Ting on the Assembly and Senator Holly Mitchell in the Senate side. And so, like I said, the subcommittee chairs report their recommendations to the full budget and the two budget chairs. And the budget chairs oversee the creation of the Assembly and the Senate's version of the budget. So sometimes they vary, sometimes they're very identical. It really just depends, like based on the year. But these two budget chairs, you know, it's super important to have their buy-in on what the recommendations are of the subcommittee chairs and what the advocates are asking for. So targeting these members is very crucial. Again, so the both Senate and Assembly budget committees will approve their respective versions of the budget. And so depending on how different or similar they are, we will end up with two different versions. Next slide. So other key budget players. So as we said, you know, two versions of the budget are being crafted, and after each house passes their version of the budget, we have to consolidate them into a single state budget. And so these are what are called the big three. So we have Assembly Speaker Rendon, who we discussed earlier, obviously the governor, and the Senate Pro Tem Atkins. And so these three members are going to be addressing, okay, what are the things that we can compromise on to figure out how we can join both of these two versions into a single budget. So concessions are made. Sometimes things are taken out of the Senate version that the Assembly, you know, has leeway to add their piece into it. So it really is a constant negotiation between these three entities to figure out how we're going to merge them into a single budget. And this is done in what's called the conference committee. So how we kind of meld these two issues together into a single bill. Okay, next slide. And so once the budget bill is fully compromised, it gets voted on before the full Senate and the Assembly. So the entire body of both houses is going to have the opportunity to vote and approve the budget. And so once the budget bill has been passed out of both houses, it will go to the governor's desk for final signature and approval, and that's a constitutional deadline. It has to be passed by June 15th. So we'll know by June 15th what our state budget's going to look like. So I think we might take a pause there and see if there are any questions.
Yeah, thank you, Linda. I really appreciate that overview. As a reminder to folks, we welcome your questions, so you can use the chat feature. It either says chat or questions on the side of your screen, and you can type your questions in there. We have had a couple already come through. Some clarifications. So going back to one of your earlier slides, you talked a little bit about the new makeup of the legislature and the supermajority that exists in both houses. Can you just explain a little bit more what that word means and what the implication is for advocates?
Yeah, that's a great question. So the supermajority means that we do have an overwhelming majority of a single party represented in our state legislature. So given that we have an overwhelming amount of one party's representation reflected, that's really going to make, you know, forming the policy priorities of the Democratic Party a lot easier, so to speak, as we move through the legislative process. So oftentimes, you know, we can look at, you know, the legislature as a team sport. And so the more players that we have, you know, on one side, the policies and priorities that we have, you know, moving forward will kind of be easier facilitated, if you will, as we go through the policy committee process and the fiscal committee process. And so these were all decisions that were really made by the electorate. The voters, determined that these are the folks that we want to have, represent us. And so that's kind of the lay of the land of how we see, the priorities and ideas that we see moving forward take a more progressive lean.
Thank you. I think we have some questions too, just about maybe you could share a little bit more about how a hearing kind of what it looks like and what a committee hearing like. How are the policy priorities discussed? And then there's some questions too about whether these hearings are available to the public to attend. So you could just kind of talk about the different types of hearings I know, you discussed a bunch of different committees, whether policy, a fiscal committee, or a budget committee. And if you could just share a little bit more about that process.
Yeah, so to describe a little bit about the policy committee process, so all the bills that are pertinent to a specific policy area will have an opportunity to be vetted by the committee. And so the sitting members of the committee will hear the presentation by the member who is bringing the proposal forward. And so usually they'll have about 3 minutes or so to describe the purpose for the bill, why it was introduced, who's supporting it, and just give a really good framework for why the proposal is warranted. And so following the presentation, the committee will hear testimony. So there are specific folks who were hand-selected by the legislator who is bringing the bill forward, and these are their select witnesses. And so those, usually it's 1 to 2 people. Oftentimes it's the sponsor of the bill, so the person who has brought the idea to the legislator. Or it could be a community member. It could really be anyone who has any tie or expertise to the issue, and then they'll have about 2 minutes or so to present on why the bill is needed. Following that, the committee will have the opportunity to do questions and answers with the legislator giving the proposal or with any of the witnesses who testified. And so that's the opportunity for the committee members to kind of dig into the details and get more feedback on any technicalities that they want to know more about. Following the Q&A, the committee chairperson will open it up to public comment. And so at that time, there's usually a microphone that's available for the community to come line up at. And then each person will usually get between 30 seconds to a minute or so to state who they are, who they're speaking on behalf of, and their position on the bill. And so that's the public comment portion. And so once that's concluded, the committee chair will then ask to take a roll call vote. And so this is when the committee members will vote to approve the bill or not. So each member has their vote, and if it's it's through a majority vote. So if the bill is successful, it'll pass out of the committee. But if the bill is unsuccessful and it receives too many no votes, it'll essentially die in that committee.
Thanks.
Oh, and then also,
go ahead.
And also you can watch committee hearings on the live stream that is posted on both the Assembly and Senate websites.
So all committee hearings are available for folks at home to watch as well through the live stream?
That's correct. So if they're not videotaped or if they're not being video recorded, they will be accessible through audio, but they will be accessible in some shape or form.
Are there any other tools that you would recommend advocates use in order to track kind of the status of specific bills and budget items and all of these hearings and everything that we've been talking about?
Yeah, so there's a great resource online. So you can track all legislation through leginfo.legislature.ca.gov. And so you can type in whatever bill number it is you want to track. You can follow the status and the history of the bill, or you could also just look at the entire list of all bills that have been introduced. And you can also categorize it by committee hearing, policy area. There's a lot of different search tools to dabble in. So that I would highly recommend if folks want to continue tracking bills to use that resource.
And how about just knowing kind of who sits on the different committees? How can folks find out that information?
Yeah, that's a great question. So on both the Senate and the Assembly websites, you can look at the rosters for all the different committees, all the chairpersons, all the sitting members on those committees. And so that's the best way to figure out who's who and who you need to be talking to submit letters or solicit support.
Great. I think those are links that we can be sure to include for folks in our follow-up email as well. So thank you for sharing those resources. I think I wanted to, there's one question here about, you talked about visits with legislators and how that's a really important tool for advocates. I know you shared some tips for how to make those most effective as possible. But I'm wondering if you could share sort of an example or just give a sense of what a successful visit might look like and what some of those follow-up steps could be.
Yeah, that's a great question. So I always think a successful visit entails really humanizing the issue at hand. I think a lot of times legislators especially in Sacramento, it's easy to kind of lose sight of what this looks like for people on the ground. And so it really is impactful when members are seeing folks from their community really describe, how this is impacting their community-based organization, and how this change in law is really going to better the district that they represent. So providing personal stories is also helpful. Just putting a face to an issue, I think, is very strong. Also, too, this kind of goes back to the research piece, but figuring out what members are most interested in is good to have in your back pocket before you enter a meeting. Not all members have the same viewpoints or have the same priorities. So identifying kind of like little background information about who you're speaking with is really helpful. I know some members, they prefer data, or they like numbers, and they really want to see that reflected in office visits. And that's something that you can do in advance of your meeting. So you can reach out to the office, speak to staff, and in advance get a sense of what that legislator is looking for and kind of the resources that they need ahead of time. So that's really helpful. Just identifying like what those needs are and then being prepared. And then I think the most important thing too is just leaving with a very specific ask and making sure that the legislator knows, what the directions are, that you're giving them, and then following up to see if they've actually done the ask or if they need more resources to help facilitate that request.
Thanks, that's really helpful. We've been talking mostly about kind of what happens in Sacramento, inside the building and all of that, but could you share a little bit about what folks can be doing in their district and more locally to support state-level advocacy work?
Yeah, that's a great question. So I would say, definitely building local coalitions is really helpful, and then making sure that you're putting together, a joint letter or something that can be sent to Sacramento to really help bridge the gap between the two. So really putting together a group of folks who want to elevate an issue. I would also say, phone banking is also another strategy. A lot of times members, they do want to hear directly from the constituents that they represent. So, calling your representative, sharing your position on legislation. I'll let you in on a tip. So in terms of calling legislators, as a former legislative staffer, every call that we got from within the district, we would tabulate it and we would enter it into our database and share with the member every time, we got a wave of calls. We'd say 50 people called yesterday in support of this bill, 100 people called on this bill. And so all of those things really make a difference. When we can share with the members how many folks have been calling in on an issue. So I would say that's something you can definitely do from outside of Sacramento. Also, targeting advertising is also really helpful. So say the member that is your representative is going to vote in support of whatever policy that you're invested in. But, a neighboring district or a neighboring city, their members having a little bit of trouble with it, instead of calling that office's or calling that senator or assembly member's office, try to recruit people in those neighboring districts who can make that ask of their own legislator, because it makes such a big difference when it's the people themselves in that community reaching out to their representative versus an outsider. So creating coalitions, creating networks with other areas of the state that have members that might be more moderate or more conservative leaning, perhaps, that are having trouble, voting on a particular issue, recruiting them or educating them about the issue so that they can make the direct ask is also really important.
That was super helpful. Thanks, Linda. Talking about phone banking made me think a little bit about social media, and I'm curious if you could share kind of how offices react to kind of social media mentions and what kind of doing Twitter storms and other kind of online action, what impact that might have on the legislator's office.
Yeah, that's also a really good question. So first of all, they love it. Giving kudos to members, on social media, on Facebook, those are all things that are retweetable and shareable. And so, making sure that we're encouraging and giving positive reinforcement, to our legislators for acting, on our behalf and acting in ways that we think move the ball forward is also very important. I would say too, given the great reach of social media, there's a lot. I don't know if you have all noticed this in your work, but I see ads on Instagram and Facebook from my legislators telling me about the different policies that they're working on and different issues. So, members are outreaching to us through these channels, and so we can also be doing two-way communication with them as well. So, for example, back to the scenario where you might have a neighboring district that's struggling with a vote, their legislators for whatever reason having a hard time, advocates, we can put a little money behind doing some outreach or doing some online social media targeting to raise the issue in different areas and identify folks who would see that information and then hopefully use that to elevate the issue to their legislator. So definitely leveraging the power of social media is a really great way to get the word out about different problems.
That's great. Thank you for sharing all of that. I think we've gone through most of our questions here, but I want to keep your questions coming. So if you have any other thoughts, please feel free to put them into the chat box. And again, we do intend to do a part 2 on this webinar where we hope to go deeper in some of these conversations that we're having today. Our next webinar is in April, and it'll be right before some of those key timelines that Linda's just mentioned. So, before the May revise, so before we get a new budget proposal, kind of in the thick of policy committees ending and going into the fiscal committees. So I think we'll have a really great chance there to take a look at how a lot of health and equity priorities have advanced and have a conversation about how we can go a little deeper on the legislative and budget advocacy skills that we've been talking about today. And so kind of to tee that up, I wanted to give Linda a chance too to maybe preview some of the work that's going on this year in terms of specific bills and budget items that we're working here at CPEN. I know that many of you on the phone are also advancing a variety of legislation this year. And we just wanted to give it a chance to, to preview a little bit about what's going on and give a sense of how all that you've discussed today is applied towards really making policy change. So Linda, maybe in the last couple of minutes, if you want to talk a little bit about the rest of the slides that you have, and then we can wrap it up as well.
Yeah, that sounds great. Thanks, Kirti. Yeah, so just very briefly, there's a lot of great priorities that we're trying to advance this year. So as you folks might be aware, Gavin Newsom issued an executive order that created the first Surgeon General. And so the Surgeon General is Dr. Nadine Burke-Harris, and a lot of what her job is to really advocate for health equity at the state level, and she's really going to serve as the thought leader around health equity and how we can advance social change, especially for youth who are experiencing childhood trauma. So that's her background, and we really hope to elevate her throughout the course of the next several years and make sure that she has a very prominent role in shaping health policy moving forward. Next slide. And of course, our coalition having our say, continuing to keep our members plugged in, and coming up to Sacramento for our Advocacy Day. We couldn't do any of this without your help. Next slide. And conducting our policymaker visits, getting folks on the ground doing the hard work in front of their legislator to really provide a face to that issue. We're going to be doing that a number of times this year. Next slide. And then identifying the Having Our Say Coalition 2019 priorities. We have 5 different buckets of issue areas that we want to address, including access to care, quality, coverage for undocumented community members, social determinants of health, and really creating a robust census. Next slide. So one of the issues that we're working on this year is a budget ask for $30 million to go towards health navigators. So we know a lot of folks are struggling to get enrolled into coverage. There's a lot of fear about public charge and what that means for immigration consequences. And so we really want to deputize trusted community workers to really dispel any misinformation folks have about their coverage and their care and help them navigate those waters. Next slide. We have AB 512 by Assemblymember Ting on mental health and cultural competency, so making sure that we're reaching folks in the best way possible and making sure that folks are getting into mental health care as they need it. Next slide. AB 537 by Arambula, improving Medi-Cal quality metrics. We know that overwhelmingly communities of color are represented in the Medi-Cal program, and so making sure that we are holding this program accountable to the people that they serve is something we're going to continue to work on this year. Next slide. AB 318, readability of Medi-Cal documents. We want to make sure that communities of color, communities who have language barriers and linguistic barriers, have the ability to understand what their Medi-Cal coverage means. And so we're going to be pursuing AB 318 this year with Assemblymember Kansan Chu to make sure that documents are field tested in the languages that are most utilized and make sure that folks can actually understand how to utilize their benefits. Next slide. We have SB 207 by Senator Hurtado on asthma trigger remediation. So we're requiring that asthma in-home assessments be covered as a Medi-Cal benefit. We know that education of folks who are experiencing asthma is one of the best tools to alleviate flare-ups. So we want to make sure that can be covered. The second piece is providing financial support for folks who need assistance in getting whatever products that they need to remediate their asthma. So that's also going to be a budget ask of ours. And then again, as we discussed, how you can get involved, make noise on social media, submit your letters of support, see your legislator in their district or in Sacramento, and reach out to the press. Make as much noise as you can about the issue, because that's really how things get elevated and how we can really create that change that we want to see. And then a couple of dates to keep in mind: March 6th is Equity on the Mall, and Health for All Day of Action on March 20th. So we can definitely be in touch as details come together on those two issues.
Thank you so much, Linda. We really appreciate you sharing your expertise. I know that we breezed through those bills at the end very quickly, but we will share these resources out to folks, the recording, the slides, as well as some of the links and resources that Linda mentioned today, in about a week or so. So we encourage and we invite all of you to join us in this work, and to reach out with any further questions. So again, I want to just thank everyone for joining our webinar today. We hope that this is a training that you can share with your colleagues and have as a resource going forward. And we'd love to hear from you still. So when you close out of this, you'll get a brief evaluation. And if you could take a moment to just give us some feedback. You can also share what you'd like to go deeper in our Part 2 webinar, so that we can have a sense of where people would like to focus a little bit more. So again, thanks everyone, and I hope you have a great rest of your day.